Hi, everyone. Today I speak with Breanne Everett, who's the CEO and co founder of Orpyx Medical Technologies. We spoke about Alberta's growing medtech innovation ecosystem, how medical devices are helping Canadian healthcare providers monitor, measure, and prevent health risks, and how she sees trends like remote care influencing the future of medicine in Canada. I hope you enjoy it.
Hi, I'm Breanne Everett, CEO, President, and co founder of Orpyx Medical Technologies.
Well, hi, Breanne. Thank you so much for taking the time to speak with us. Please start just by introducing yourself and what your company is focused on.
Sure, thanks so much for having me today. So my name's Breanne, and I'm the CEO of Orpyx. I co-founded the company in 2010 after experiencing one of the what I really see as being the largest problems in the management of people with diabetes, which is diabetic foot disease. I had done my MD. I started my residency in plastic surgery. And in the course of doing that residency, I was seeing people every day who were losing their legs as a result of diabetes. And the underlying issue is the fact that most people with diabetes will lose feeling in their feet over time. And because they can't feel their feet, they don't have protective sensation, and they'll unfortunately develop wounds from over pressures over time that can require surgical intervention, including amputation. And so the idea that I had was to create a technology that would use sensors to help measure and manage people living with diabetes with a sensor based insole so that they could prevent wounds from happening in the first place and hopefully prevent those horrible events like amputation and loss of mobility from ever happening. Just to give you a sense of what this means from a clinical perspective, we've done a number of studies using the technology. And with that, the algorithms that we've developed, we're able to, with people who are compliant with the system, prevent 86% of wounds from happening in the first place.
Awesome. Sounds like a really cool product and obviously one that really improves lives. So, definitely a noble cause there. You founded the company in Alberta. So, I'd like to know from you how you describe the province's life science and medtech ecosystem, what you see as its strengths, its opportunities, and what exists going forward for the province and its entrepreneurs in this space.
I think we're just at the beginning of a really exciting wave of the growth of the number and size of the health tech companies in Alberta. I certainly I guess my most of my experience is based out of Calgary, and I've just seen that over the last probably 3 to 5 years, there's just been a very palpable increase in the number of health tech companies. So digital health companies, medical technology companies, and we're starting to attract some really exciting leaders who have had success in, not necessarily just health tech, but in technology in general, to start really focusing on growing that ecosystem. And so you're seeing this influx of talent, which is helping with the scale that we see. So companies like Orpyx and Cyantra are two of the larger companies that are really growing, getting traction, attracting investment. Um, and I think that we're going to see within the next probably 2 to 5 years a number of impressive growth stories, hopefully some strong exit stories, and all of that really paves the path for new technologies, new entrants, expertise in the area. We have infrastructure that's also being developed that is helping support these companies that are growing. So the BioHub X is something that has been established by a group of leaders in the community to really incubate and help grow and support health tech companies. And so I think that we're we're really at the start of something exciting, and I'm thrilled to be a part of it. And it feels like we're starting to build a community and network, this network of trust that really helps to form the foundation of any industry. And then we've got on top of all of this just really exceptional institutions that are interested in research, the translation of knowledge from within an institutional setting outside of it, and more and more programming that helps us to actually bridge that gap between industry and academia, like the MyTax programming. So all of those things taken together, I think, put us in a really good position for a strong future in health tech in Alberta.
Now, you just touched on one of the most important issues in life sciences, which is the translation of research and innovation that comes out of our institutions into actual commercializable, scalable products and companies. How would you describe that dynamic within Alberta's health and life sciences ecosystem? And how easy or how much support is there in terms of commercializing the research that comes out of its advanced education institutions?
Yeah, that's a great question, and particularly within medicine, you've got this tension that you have to resolve to be able to allow for that movement of ideas into more of a business domain or an entrepreneurial domain outside of the walls of those institutions. You have frontline workers who see issues every day that could be addressed with improvement in the tools and equipment we use, the processes we use, any of a number of things to improve the efficiency and the outcomes that we're able to generate within the health system. But the problem is that all of those frontline workers are so tasked with the frontline work that how do you get that outside of that setting? So I think often it's not an issue of a reluctance to do that. It's a time and a resource availability. So I know there's work being done now in looking at how do you start to bring in uh, other offerings, programs that actually help and work with medical or surgical entrepreneurs to help with bringing those ideas from concept to solution and then scale within the real world. So I think ultimately this what this has to be is it has to be a scenario where you have those sort of idea generators, frontline innovators, paired with entrepreneurs who kind of want to take the business torch all the way through. Um, that's really key is having those supports, that guidance, bringing in people who have done it before to really kind of be those individuals to carry that across the line. And then outside of medicine and surgery and just within the institution of, for example, the University of Calgary in general, where we've worked extensively with the Human Performance Lab, programs and uh, ideally provincial or federal programs that actually fund and support those projects where you're allowing for that bridging are very, very key. So MyTax has been exceptional. I cannot say enough about the MyTax programming. I've been very happy to see that year over year there's been continued funding in that space because it truly has changed how we can develop relationships with institutions and bring the best of research to support the growth of a technology company. So more of that is always very helpful. It not only provides the funding, but also provides the invitation for people to set up those relationships.
You've set your focus and that of your company on creating a world where healthcare is oriented towards prevention at a sustainable cost. Can you expand on why that's your goal and also what you think needs to be done or what mindset shift we need to achieve this at a large scale?
Looking at our current state, we have we have an aging population. We have more and more chronic disease that we are now managing than we've ever managed before, and that's people with multiple comorbidities, multiple medical complications that are being managed through a combination of at-home management plus in institution management. And you can quickly envision a point where we have way too much of our healthcare actually happening within the walls of an institution once something goes wrong. Because we have a finite number of institutions, we have a finite number of people running those institutions, we need to start to think about ways where we can measure health in the real world and put the onus on patients and individuals to be measuring those physiologic or physical parameters of interest so things can be addressed either by the patient themselves or when needed that they can go and be seen. And so with what we do, we're very much focused on the physical human that we're measuring and the movement footprint of that individual. So although our first application is very much focused on management of somebody living with diabetes and diabetic foot disease, um, the system itself is capable of doing so much more in terms of measuring activity, quantity, quality, qualifying what type of activity an individual is doing, how many steps they're taking per day. So there's so much that can be done in that space, and it's just incumbent upon the people who are innovating in this space to come up with the best solutions that, taken together, can do all of the possible chronic disease monitoring that we want to do in the real world, pull that outside of a hospital setting and be as efficient as possible with resources, because we know that if we can have that care happen at home, it's A, more preventative, and B, much more cost effective, so you can run a health system with fewer resources, and that's really ultimately the goal.
I want you to gaze into your crystal ball as somebody who's deep into the Albertan and Canadian medicine and medical technology space. How do you see the sector evolving? What are the trends? What are the forces shaping it? What do you see in the next couple of years?
Yes, that very much ties into what we just went through with remote care. So I think this is going to be one of the biggest shifts that we'll see over this period of time, is that um, if there's any portion of care that can happen at home, it should be happening at home. And so that shift is imperative. The CMS actually introduced, so CMS, Center for Medicare and Medicaid, ended up introducing a series of CPT or procedural codes for remote monitoring, remote patient monitoring. So what now happens is that a device can be prescribed for the purposes of remote monitoring, and based on patients using that device, the data coming in from the device, and the ongoing analysis, interpretation, and engagement with the patient on the basis of that device, that can be reimbursed for very broadly. With the work that's been done by CMS and the, I guess, early data we have on usage of these technologies, uh, what is very clear is that subspecialists and primary care physicians are very interested in helping with shifting to this type of model. The biggest challenge for us is going to be making sure that those interventions that are being used, or those monitoring devices that are being used, are the best possible monitoring devices. And I think we're going to see more and more guidelines around what type of device or devices are appropriate for different types of patients.